Yes, yes. Mm. Admission. Mm. Amekiuza kuwepa oxygen, acha adhibitiwe huko. Eh, eh. Welcome to the platform. And welcome to the platform. Another day, another good day has come, and we Bubbly Beth is here. Welcome, Bubbly Beth. Thanks to be here in this platform. Today we're gonna discuss about amoeba. Yesterday we discussed about something very funny, and people were really excited. And we talked about several things. Several things. As we talk, just let me do some things like we share links so that some people who want to come in the platform can. There are some people who are really interested in some topics that we do. So when I come online, I like sharing the links so that they can learn. Sorry about the noise. It's good to learn together and not leave anyone aside. So today we're gonna discuss about amoeba. Everyone talks about amoeba, and amoeba has become a very big problem to the society. Let me share this out too. Yes, thanks, Bubbly Beth here. Amoeba has become so much a problem to some people, and some people have always been having a problem with amoeba. You know, amoeba can cause several things. Amoeba can cause even uh, Amoeba can cause even liver damage if you don't know. If you are not careful with treatments, amoeba can cause some bad issues in your health. Yeah? So it is important when you are sorry. It's important when we are discussing and you have some questions. Please don't keep the questions for yourself. Sometimes it's good to ask. So when you ask some questions, it doesn't mean that you are asking a stupid question. It means you want to know more, and the more you. Hello, Live 24 is here, Master. Welcome. Namaste, brother. I'm watching you from India. Thanks a lot. Margaret in Norway is in the house. Welcome. And we cherish every presence of everyone who is here. And as I usually say, if we are discussing these issues, if we are discussing these issues, if the topic is amoeba. Let's just ask things about amoeba. It's an open discussion. Let us discuss issues concerning everything medical. If you have a personal issue that you want us to discuss, bring it to the platform. If you have an issue that is private, I help people worldwide. I help people worldwide. Please don't keep the issues to yourself. Be it is mental health or it is something else that you think a doctor can help. Make me a call, reach me through my email address. Let's see how we can help. Now, the topic of today, this week, from last week, we have been talking about issues about the stomach, gastric issues, the abdomen, because the abdomen carries several issues, the several things like large intestines, small intestines, all those. It carries all those. You get it. So it is very important to check to ask any question concerning whatever you are going on. Today, we are discussing amoeba. There was a time we talked about typhoid, and amoeba is one of the problems that gets into our tummies and then you become so bad. Amoeba refers to a group of greetings, Dr. Benjamin, and everyone in the chat. Welcome, Jamaican uncle. We thank you for your presence and always your support to everyone. Margaret in Norway, thank you a lot. And all like hello live from India. Now, amoeba refers to a group of single protozoa, but the most important one affecting the human is called Amoeba histolytica, which causes disease that is called amoebiasis. So let me tell you one thing. You can be having amoeba in your system, but you don't have this anti-amoeba histolytica. You get it? So groups of amoeba. So if you have amoeba sorry about it, there's something I'm doing. If you have this one that is specific, that is called enter-amoeba histolytica, that is what we call a disease called amoebiasis. The infection mainly affects the intestines but can also spread to the liver and other organs. So there are several, I'll name several groups of amoeba that we know, and these amoeba infect human and cause diseases, all of them. But the one that is causing diseases so much, it is E. histolytica. E. histolytica, enter amoeba histolytica. And then we have Naegleria fluoeri, primary amoebic meningoencephalitis. You see, there is another one which can make you have a problem in your brain. This one is a very bad one. It causes a problem in your brain. And then we have another one which is called Ankata amoeba. It causes encephalitis still in your brain. You get it? Keratitis. And as we go on, please, if you want to a shout out, just please just say please as we continue, because we are here to connect and create a big family. So all that can help to post the links so that we can grow, it is important to post. Muthia mandrillalis. This one is another one. Gliomatous amoeba encephalitis. You see, we have 4 types of amoeba. Enter amoeba histolytica, Naegleria fluoeri, Ankatha amoeba, Blamuthia mandellaris. All these are types of amoeba, but these ones that I've named, amoeba is a microscopic single-celled organism, constantly changes shape and usually a jelly-like consistency. Yes, very important. Yes, but now Bubbly Beth has really defined it as well. It's you cannot see it with your eyes. You have to look at them through a microscope to see it. It constantly changes shape, but we have seen the pathogenic ones, the ones that cause pathogen. Yes, that's for those who are unsure about what amoeba is. Thank you, Bubbly Beth. Thank you so much. The ones that cause problems in human beings is E. histolytica, Entamoeba histolytica, Naegleria fluoeri, Ankatha amoeba, and Blamuthia mandrillalis. Those ones are the ones that cause problems in your health. And then we have those ones that does not cause. We have problems. They are harmless. If you have them, you are still okay. Entamoeba coli, Entamoeba dispa, Entamoeba hartmanni, and then Endolimax nana and Lado amoeba buscilii. Those ones, if you have them, they will not cause problems. You see, we have very many types of amoeba. They live in the human gastrointestinal. The ones that are pathogenic, the ones that bring problems, they live in your gut. They live in your gut. In the small intestines, the large intestines. Entamoeba coli, Endolima nana, and histolytica, Those ones, they live in your intestine. And there are some that are free. They live freely. They can live anywhere. Floweri, Ankata amoeba, and Mandrelalis. Those ones live freely. Um, we go back to check um, the overview of amoeba, how amoeba can affect human being, how it is transferred, and the signs and symptoms when you get amoeba. You see, sometimes amoeba, you can confuse it with another disease. Please, as we talk, if you have not liked the video, please like it. You know, when you like and you are chatting and you have a channel, it gives an impression even to your channel, to other channels. So please like, we improve impressions. Like the talk, like the video, we increase impressions. Overview of amoeba infection. How does amoeba come out? I know about amoeba from local water and soil samples under my microscope, but I was not aware about us having amoeba in our stomachs. Bubbly bed. There are so many free living microscopic uh, things that live in your stomach, and these free living things, one of them is amoeba, floweri, and the others that I've named. And then we have the others group that live in your stomach. There are some bacteria that live in your large intestines that help you to process something called vitamin B12. If you don't have them, you will not process vitamin B12 well, like this one that was named after metronidazole, which is called Bacteroides floweris. And then we have Latoralis, Bacteroides latoralis. I'm learning. Thank you, Dr. Benjamin. Welcome. Come in. Those ones are always uh, in the gut. Like, if you don't have them, there are some nutrients that you will not produce. You get it? So in amoeba world, there are some amoebas that live in your body, but they are harmless. But the most one that brings problems to the human body of a person is this one called entamoeba histolytica, which causes the disease called amoebiasis. It is causing a disease called amoebiasis. You get it? With areas with poor sanitation, contaminated water or food, person-to-person transmission. When sometimes someone is infected with amoeba, and then you go on hugging, shaking hands, and you go eat food. This is a fecal-oral transmission protozoa. You eat food with dirty hands, and you've been shaking hands with people that are affected with amoeba, especially amoeba histolytica. You will get it. You will get it. Yes. 6666 watching, more coming in. We are watching and more coming in. Let's go improve the likes. We want more impressions, and the people that have even the channels. If you are here, let me give you a secret. If you have a channel and then you are watching a person that is having a channel, if you like or share, it increases the impressions that of your channel, so you become more famous. Now we continue on causative agents. We have said, when you have the problem, amoeba is the protozoa, it is the parasite, but amoebiasis is the disease. So if you have amoeba but you don't have symptoms and you are okay, because there are some types of amoeba that don't cause problems, it means, what does it mean? You are not sick, you don't have amoebiasis. It is just living like symbiotically with you. It is living symbiotically with you. So let's talk about forms of parasite. So when you eat the amoeba and then you ingest it, you get some things called the cyst in infective stage. The cyst survives outside the body, in the soils, when you in the rails in your homes. It survives because it has a coat that does not, it's not affected by drugs or the environment. It is found in contaminated water and even food that is not cooked well. Mm? It is resistant to stomach acid. So when you eat this food that is contaminated with the cyst stage, because you know stages of amoeba, there is something called the cyst, and then it comes to sporozoites. After the sporozoites, that's when the amoeba comes in. So you eat food, or you women that are pregnant, women that are pregnant and they love eating soil because of iron deficiency or input output demands, you start eating soils. What happens? Maybe you eat a soil that is contaminated and has cysts. It goes to your stomach because your stomach cannot kill it because of the outer part is hard. It comes out to an active stage which is called the sporozoid. Lives in the large intestines. Now, you know, in the large intestines where that is where some nutrients and vitamins are created. So the sporozoids comes and they start ingesting the same nutrients that you have, and they start causing tissue damage like the walls of the large intestines, and some other nutrients that you are supposed to be ingesting, they are destroyed. And here is where the symptoms come. Water is absorbed in the large intestines. We all know that. And when the sporozoites are at work, they destroy the chemical nature of those places. I said there is something called CAMP circle, where when your walls of the large intestines are destroyed, now you cannot ingest, you cannot absorb water. You start now diarrheaing. You diarrhea will start having abdominal distension. And let me tell you one thing: when you have a stomach that is distended and bloating, it an abdomen, it is not your stomach that is bloated. Your stomach, you will always feel pain when you have gastric problems and belching. But when your stomach is distended and your feeling is so tight and it is big, the large intestines are the ones which are bloating. The large intestines are the ones which are bloating. You get it? When people say that my stomach is, I'm having a bloating stomach, it's not the stomach which is bloated. It is the large intestine which is causing the distension. So the stomach itself, when it has gas, you belch and you feel pain because of gastritis. But when you have stomach distension and bloating a lot, what do you find? You find the large intestine have a problem. So when it is in the trophozoite stage, because amoeba has 3 stages, you ingest, you have to eat a food or water, drink water that is has a problem, or has the cyst. Then they come to your body. You say this is cystic stage, where they are resistant. They stay like a week, then they become trophozoites. When they become trophozoites, what happens? This is the active stage. They start damaging the nutrients and they start damaging your walls. Now, the infection spreads when a person ingests the cyst. That one we have said. Contaminated water, raw or poorly vegetables, food handling, not cooking well, not uh, washing raw food with clean water, poor hygiene, and also contaminated surfaces, because you can walk up at let me say some rails in supermarkets, hypermarkets, and offices. So the people who are there, one of them is sick and has this bacteria. So you touch and then you start eating your nails. You touch surfaces, you start eating your nails, and then you become sick. You become sick. That one is a problem. Now, pathophysiology. Pathophysiology is how this bacteria destroys you. You ingest it as cyst, that one we have said, and then we have the stage called excistation, where the cyst now breaks. This is in the small intestine. The trophozoites come in out. The trophozoites are small amoebas that now, let me say, the children of amoebas. Then the colon inversion, they go to the colon, the large intestine. Hmm? Amoebas go to the large intestine. They attach themselves to intestinal wall. They attach to the mucosal surface, to the wall of the large intestines. When they attach themselves there, this is where now the fun of amoeba comes in. The parasite releases some enzyme called protease, hyaluronidase, cytotoxins. And then these enzymes, they are the ones which breaks the cycle of CAMP, and then you form as ulcer in your large intestine. Ulcers. You see, amoeba can cause ulcers. Yeah? What enzyme can you repeat? What enzyme can you repeat, please? Oh, we have protease enzyme. We have hyaluronidase. Let me post them so that you can look at. And then we have cytotoxins. Cytotoxins are enzymes that destroy cells. I'm texting the enzymes there so that you can at least read about them and what they can do. Cytotoxins. Those are the enzymes. The enzymes that let me. These are the enzymes. And you see, these enzymes, we are talking about Amoeba histolytica, the one that is so pathogenic. Those are the enzymes. So when they start releasing, the amoeba starts releasing these enzymes destroys the protective layers of your large intestines, and then you form ulcers, causes flag-shaped ulcer in colon. Ulcers, a simple word for an ulcer is called a wound. You get it? Spread to the blood, and then they spread to the blood, enters the portal circulation. Now, the portal circulation is the circulation from the liver and the intestines. That is what we call the portal circulation. Blood circulation from the uh, intestines, and then to the main artery, to the main vein, and then to the liver. So they go to the liver. And when they stay in the liver for so long, because this enzyme destroys cells, much of cytotoxin, the toxins, they destroy cells, your liver starts having abscess. The liver cells starts to die. The liver cells starts to die, and they form abscess. You form pus filled in your liver, and this is where we call it amoebic liver disease, amoebic liver abscess. Please don't just watch. Give me some likes, and we continue, please. Some likes. Let's get some likes. I'm seeing some people are coming and going. Yes, good. Give some more likes as we go, more likes as we go, so that we can increase more impression, so that people can know. Now we have talked about can the ulcer become big, then they form a blockage. Yes, you see, when an ulcer causes let me see if I can do this. I want to show you some pictures of ulcers that have formed constrictions. So let me open today I did not open the software. Let me open and see if I can, I can show you the ulcers. Now you see, if ulcers continue and they continue getting to the walls of to the okay, let me see, manage broadcast. Let me see, just amoeba, yes. Select and strip. If the ulcer continues to examining body fluids and organs in your body, a doctor in the field is called a pathologist. So yeah. In pathology, just a minute, guys. I'm trying to share some picture. What are we talking about? Okay, let me check this out. Let me check this out. I'm trying to I'm trying to get microscopy. They do find into respiration to find out what is the problem. Histo, the tissues, cytology, they study the cells. So cytology, they study the cells to get to know why are these cells multiplying like this. This is pathology. Clinical pathology, laboratory medicine. They examine, analyze urine and other blood fluids. You get it? Very important, and it is very important when it comes to the studies of cancers, a pathologist. Yes, there is something called forensic pathology, determining the cause of death in illegal cases. When a person dies and you go and request for an autopsy, there is this guy who is very serious. This guy or this lady who smiles every time, very humble. But he's a doctor who is called a pathologist. Yes, Kingre, welcome. Welcome to the platform. We are talking about branches of medicine. And everyone who is watching, please follow Kingre, like her videos. She's a nice lady. She likes smiling every time. She's a humble one. If you like her videos, we'll always smile and feel nice. The Kingre, welcome to the platform. Don't forget Mercy Grace. They are always smiling ladies. Their platform is full of smiles. Yes, let's continue I've said forensic pathologists. When someone has died and you have asked for an autopsy, this is that person that will come there, do his thing, do the cadaver, the dead body. He'll go inside there and do his thing, and he'll find the cause of death of this person. So let's respect the forensic pathologists and the pathologists at large. We have the last one that deals with family medicine. Family medicine. You see how many doctors we have talked about? Medicine is a wild field, my friend. Medicine is a wild field, and we have talked about so many things. Smile, greetings, doctor. Smile in the city. Smile in the city. Welcome to the platform. We are talking about branches of medicine. People are confused. There is someone who called me a herbalist today, and I felt it is good I talk about branches of medicine. So we are at the family medicine. Family medicine is an important branch of medicine. Eh? These are doctors that are trained that provide comprehensive and continuous health care for individuals and family across all ages, genders, and diseases. This is family medicine. A doctor in this field is called a family physician. Do we have everyone who is listening to me right now? By the way, if anyone has a question, let me not just talk. It's a random question. Please ask me a question that you like me to answer you as we continue. You can just post it there. Now, sometimes ago, we used to have family medicine, family doctors. That these people, these family doctors, what do they do? They talk about. I'm trying to correct it. I've logged I've logged in the software. I'm good. That's kind of hope we are true. I can hear two voices. Oh, I've removed it. I've removed it. Yes, yes, yes. There is a picture that I want to share so that you can see what Amoeba can do. What Amoeba can do. Let's uh, uh, let's see that one. I'm uploading that picture. That just a minute. Just a minute. Please give me a minute. I see. You see when you view these things, you 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 appreciate the issues that are coming. Now let's go to where the picture is. Let me see where the picture is. Yes, the picture is here. Picture is here. Okay. Now the picture that is coming out, the picture that is coming out here is of the large intestine. A person has two types of large intestine. There is an ascending one, the one that I'm pointing. I don't know if you are seeing it. The one that I'm pointing is the ascending large intestine, the one with the appendix. And then we have the one that is descending, this one that is the large intestine. But we have the transverse. This one is the transverse. Amoeba always affects this one, the ascending one. Most of amoebas enterolytica affects here, where the water is being absorbed here. Most of them don't come here, but most of them come to the ascending one here. So you see there, you can see there, this one is more constricted. The size is smaller than here. So when amoeba attacks this size, let me make it bigger so that we can appreciate. Make it bigger. So when amoeba gets to the colon, when amoeba gets here and it has brought in an ulcer, and then the ulcer continues, you have not received treatment, you have not received any treatment. What happens? This part starts to constrict. So you will not pass stool as normal. That is where you start having bloated abdomen, because this one now starts retaining fecal matter. It starts retaining fecal matter. It is very important to take care of your sanitation, because the picture that I want to show here, I don't know if some people will like it, but let me just, no, that one is bad. Let me show, I want to show some pictures that at least they will make you know amoeba is not a good thing. Amoeba is a very bad thing in the society. It's a very bad thing in the society. And let me find that is free. I'm trying to find a picture that every person will appreciate and see. The amoebic colitis. What Babli has asked is, it lies on a group of complications that is called amoebic colitis. Colitis is wounds in your large intestines formed by the amoeba. You have not been treated for so long, and then you start having colitis. Bloated stomach, wounds in your stomach. You see, bloated stomach, wounds in your stomach that are not healing. I'm trying to find this. Where is it? Sorry. I'm trying to find something here. I don't know why is this not. Okay, let me share this. The picture is coming. There is a picture that is coming. My brother died from colon cancer. Do you think it can cause from these two? Can the ulcer burst and cause infection as well as obstruction? Now, yes, probably, as you look at that picture that is in the walls, look at it so well, you will see that it has called constriction. And if, sorry, I'm trying to find a picture that is well to bring it on top. And if you continue having not treating the wound that I'm pointing at, media source image. If you don't treat it, what will happen? You will have ulcers and constriction and retaining fecal matter. You will not go to long course, and if you don't go to long course for so long, what will happen? You will have problems to your, it can burst, and then you get to a system. Where is this picture? Sorry, let me get it. Let me get this picture. Okay, it's here. Not that one. I'm trying to find. There is a very nice picture here that someone will appreciate and know what is. But I'm trying to save image as that one. I'm trying to bring it. Yes, I've seen it. Let me see it right now. In folder. Okay. Um, Now I'm trying to bring it to see so that you can see what happens when you have amoebic dysentery. Amoebic dysentery. Where is this picture? Just a minute. Just be patient. Be patient, please. We usually say in Kenya, be patient, tafadhali. Tafadhali is please. Tafadhali is please. Tafadhali is please. Please, let's share the. As we go on, let's do what? Let's like the video, please. Let's like the video so that we can increase what is called impressions. Now this picture has come. This picture has come. You see that picture? Those small things that you are seeing here, these are amoebas, and this one is the wall of, this one is the wall of your large intestines. You see now it has formed an ulcer. It has formed an ulcer, and that's when you get what? That is when you get the problems of your sorry of your colon collapsing. Jamaican uncle has asked a very nice question. He has asked about sorry about your late brother from colon cancer. Now, I think I've answered Bubbly. Bubbly has asked this question here. She has asked, can the ulcer burst and cause infection as well as obstruction? Now, Bubbly, I will answer this question like this. An ulcer is a wound. An ulcer is a wound. If it has gone, so you see how this ulcer started. It has gone through and it has passed through from the top, and it has created a hole. That one is called a fistula on the colon. A fistula is a communication between inside and outside. That is when you get a problem called septicemia. Septicemia. But when this one is like this, you see how this one is? It makes stool not to pass as needed. So that is when you start having distended stomach, abdominal pains, and when you are going to the loo long course, you have a very your stool goes, you are like you have stayed for so long, you feel very relieved because it comes out like a bullet. It comes out like a bullet. So we amoeba, we have seen this is the stage called the trophozoid. The stage called the trophozoid. So I think I've answered. If the ulcer continues and cuts through, because it's a wound, it can continue going, and cutting inside up to leaving a communication between the inside of the colon and the outside. We call it something called a fistula. So abscess is in the liver. Abscess is in the liver, and the abscess can burst. But you can also get an abscess in the colon. It depends with where you are. Because if you look at this picture, let me bring it again, Bubbly. If you look at this picture here, if this closes, if this ulcer closes and then there is pus inside here, a lot of pus inside here, that will be an abscess. So you can also get an abscess in the colon, but most of the abscess are in the liver. But you see, when you have a amoebic abscess, that one is an admission case, and you should be in inpatient, and you should be taken care of in inpatient. Please, let's continue asking more questions. Now, Jamaican uncle has asked a very important question. My brother died from colon cancer. Do you think it can cause from these two? Yes. You should check why colon cancer is coming. Colon cancer has so many causes, genetic causes, and also H. pylori, and also amoeba. When amoeba is eating through your layers, and it is not being treated, and the ulcer becomes persistent, do you know what happens? The cells around the colon, what they do, they start metastasizing, they start mutating. And when they mutate, I think we will talk about cancer so that people can understand what cancer is. I will talk about cancer before the week ends. So when it changes their way of doing things, this is where we call it cancer. Because now the wound has been there for so long, and the cells now are mutating, doing some things that they are not supposed to be doing. So this is called cancer. And cancer, what do it do? You start bleeding abnormally, you start having abdominal pain, you start having problems in digestion and absorbing food. You see all these things. You start having all these things. Now we have talked about. If you have any other question, please ask this question so that we continue. Let's interact. Let's interact. You see, when we are just talking and people are not asking questions, you feel like everyone knows a lot than you know, or you know a lot than everyone. People have experience, and the experience are the ones that make them better. So I want everyone's experience. You see, Bubbly is a learned girl. She knows some things, and she's asking questions, and is challenging, and we are continuing. Now, let me shout out Jamaican uncle Bubbly, Betist World. Betist World has a channel. Please, let's visit Betist World. Let's visit Jamaican uncle. If you are new here, please visit Jamaican uncle. If you are, we have seen Hello Live is here right from India. Right from India, Hello World is here. We have another one. We have so many people. Margaret from Norway, all the way from Norway, is here, and let's continue learning about. Yes, hello. Let me finish, then I call you. Please, please. We have another people that are in platform with and they have channels. Let's interact. Post your channel. Let's follow you. Let's appreciate what you are doing. So I think I've answered Jamaican uncle. Yes, that can happen. I know another person who cannot eat nuts because it starts in some pockets in the colon. Because this person, Jamaican uncle, is saying, I know another person who cannot eat nuts because it's stuck in another pocket in the colon. Yes, you know, when you have ulcers and they heal, your your colon becomes ragged, and it can the nuts can stuck there because the flow of food in your gut becomes a problem. So that one can be a problem, Jamaican uncle. Maybe this person is healed right now, but he has had this problem for so long, for so long. And then we have someone. There is probably, does irritable bowel syndrome have anything to do with amoeba? Irritable bowel syndrome is a very different. IBS is a very different thing from amoeba. Why? Because amoeba causes amoebiasis. It is a protozoa. But when we talk about irritable bowel syndrome, we say it is inflammation of your gut. We will talk about irritable bowel syndrome, but when we started this topic, please check the video of complications of the bowel. I had the introduction. Inflammation of the gut. Okay, I never used to have IBS, then suddenly I do, and I still understand why it suddenly came on. Tomorrow we will talk about IBS bubbly, and I know you will appreciate. This is totally different from I still don't understand IBS. Yes, tomorrow we will talk about IBS, and you will appreciate things that can bring IBS. Most of them are like H. pylori, mental problems, stress can bring IBS. infections. Amoeba can bring IBS, but at a very low percentage. We will see tomorrow. Tomorrow we'll talk only of IBS. So be linked up as we talk. Let's finish amoeba, then tomorrow we talk about IBS. So if you have IBS and you have been diagnosed about it, you will learn more about how to take care of your problem. Now, we have talked about transmission, the hygiene, we have talked about pathophysiology. Pathophysiology means how amoeba damages your body, up to where it goes to your liver. Now, damage caused in human body about amoeba. Intestinal damage, it causes ulcers in your colon, destruction of intestinal tissues, and also bleeding. Because when you have intestinal ulcers, those ulcers will bleed. Those ulcers will bleed. And if you continue bleeding, your HB goes down. You start being anemic. You get it? Now, we have said it goes up to the liver and it causes abscess. So, an abscess is a dying tissue. You start having fevers, you start having low HB, tissues that are necrotizing. Necrosis tissues are tissues that are dying, And then, because you are having abscess in your liver, what happens? Your liver swells, it becomes bigger. You get it? And but there are sometimes people have complications like lung infection, brain infection, and skin ulcers, because when you have amoeba in your blood, the trophozoites are going through your blood, they can go up to your brain. So when it gets to your brain, you get encephalitis complication. That is where problems get in. Now, clinical findings. Intestinal amoebiasis. Now we are talking about the symptoms of amoeba. 1. Abdominal pain. 2. Diarrhea. 3. Bloody mucus. Bloody stool mucus. You get stool that has blood and mucus, because amoeba itself, we have seen the enzymes that it produces, and those enzymes come out as mucus. You get it? And blood that is it is raw because of the ulcers in the colon. Tenesmus. Sometimes when you go to the loo and you want to pass stool, painful urge to pass stool because of the ulcers. You always fatigued, because if you have ulcers and you are bleeding, what happens? You get anemia. So low HB gives you fatigue, weight loss, nausea always, fever, because it's an infection now in your bloodstream. And you know, infection is equal to fever. And then we have abdominal cramps. Now, when it comes to amoebic liver disease, you have to go to the hospital. You have to go to the hospital and you do something called an ultrasound. They will see a lot of pus in your liver. This is where you have a very severe abdominal pain, diarrhea, bloody stool, mucus in stool. You get it? All this that we have named, fever, and loss of appetite, jaundice, because your liver cells are dying, and when liver cells die, they produce biliverdin, bilirubin, and heme and biliverdin. Biliverdin it produces bilirubin, which is yellow, and it is deposited on your eyes, just like in malaria. So you have jaundice sometimes in the eyes, shoulder pain, weight loss. Now you have amoebic liver disease, loss of appetite. Your liver is enlarged. Even if you touch it, you touch where the liver is. You touch where the liver is on your right, you will feel a very hard mass that is bigger. You see, it is very important to go when you're going to a hospital and you are told, please check the stool to see if you have amoeba for microscopy. Don't say, I don't have it. Please listen to the doctor. And you know, if you don't listen to the doctor, do you know what will happen? These are the complications. It will damage, you will have perforation, you will have holes in your intestines because of the ulcers. You will be bleeding toxic megacolon, because when it is constricted like the picture that I have shown, let me show you the picture again. This picture here, and then it is constricted here. You will not pass stool. You will be from the small intestine, stool will be coming, and then it is bulging and bulging. I don't. Let me check if I have a picture of megacolon. Megacolon, toxic megacolon. And you know megacolon is not a good thing. Megacolon is not a good thing, my friend. My friends, megacolon, if you have megacolon, this is how, let me share the megacolon you see. You see how if you don't treat amoeba and you ignore the danger signs, what it will do to you. This is what it will do to you. I want to show you megacolon. Megacolon is a very bad situation. Very bad situation. Megacolon is a bad situation. I want you to check out this. I want you to check out this. Now that you have you have a constricted place that fecal matter is not going through, this is what you will have. You see this? This is a colon that is big. And you look at that lady there. This lady seems like she's pregnant, but you see it's the colon which is not passing through because of the ulcers that are not doing what? Healing, and they are constricting. So megacolon is painful. That is what we call toxic megacolon. Toxic megacolon. Toxic megacolon is not a good thing. So we have to treat amoeba. At any case, we have to treat amoeba. We have to treat everything that comes with amoeba. If you get toxic megacolon, my friend, it is painful. You go to surgery to open it and resect. Resecting means to do what? Resection means to open up the colon, cut it, and then sew it again so that it can be complete. You see, those are very bad experiences. Those are very bad experiences. So let me see, there is a problem with the network, but it's okay now. Let's continue. Let me see. If you have a problem with sound or anything, please just say I have a problem with sound so that we can continue. We have seen what toxic megacolon is. That is called toxic megacolon. Look at it. Toxic megacolon. You see that? That is called toxic megacolon. Toxic megacolon is not a good situation. So we continue here by saying that we have to treat this condition. We have to put our sanitation at par. We have to have sanitation, good health measures wherever we are, in public, at home, and everywhere that we live, so that we cannot do things that is good to go to the toilet when you have any meal. I always have to do that. Yes, it's good because you are relieving and you are helping. Jamaican alcohol is very good because you are giving away to foods that you are eating, so that you cannot get the toxic megacolon. Let's see. There is something called peritonitis. That one we will discuss. Fluids from your stomach getting to your peritoneal layer of your skin. It is very painful. You get it. Sepsis, infection. You get infection. Chronic colitis. Chronic problems in your colitis is saying colitis is it means you have colitis means that you have colitis means that you have what? You have ulcers that are not healing. You get it? Now, when you go to hospital, what they can do if it is late, they do an ultrasound. They assess if you are live with Russell's. Greetings, welcome. If you are in the stage of amoebic liver disease, what they do, we drain the abscess, then we put you on heavy antibiotics. After heavy antibiotics, what you start having is continuous therapy as you heal. If you have ulcerative colitis and the colon as a problem, you get to surgery with it. There are some medications like metronidazole, tinidazole, paramycin, and digoxanide furanate that helps to heal this. But the most important thing in the life of amoeba, the most important thing I can say is this: oral rehydration, nutritional support, pain control, and drain of liver abscess. But we have said prevention is the key. As I finish, I have 5 minutes to finish. If you have a question, please you ask. If you have a question that's asked, I have 5 minutes. I have 5 minutes, and today people are not posting their channels. Please post your channel, post the link so that people can follow you. Now, the key thing when it comes to amoeba: drink boiled or treated water, wash hands properly, wash fruits and vegetables, avoid contaminated foods, improve sanitation, proper sewage disposal, and health education to those that don't know about this. We have talked many things about amoeba today. If you have a question, I have 3 minutes. If you have a question, I have 3 minutes. Please ask if you have. I'm waiting for any question about amoeba before we log out, because when we ask questions, that is where we become educated and we know more about what we are undergoing. So if you have a question, this is your time. Let's ask questions. But I think Jamaican Uncle is coming live, and it will be premiering at 7. Let's go and support Jamaican Uncle. Margaret, always let's support her. Betis World, let's support Betis World, please. And as we go on, okay, I have how many minutes to go? Let me see. I have 2 minutes to go. 2 minutes to go. I have 2 minutes to go. Okay, 2 minutes to go. Okay, I think everyone is good. Let's meet tomorrow as we discuss something that is called irritable bowel syndrome. Thank you, everyone, checking out here, checking out in my channel and discussing and talking about amoeba. Let's visit Jamaican Uncle. We see today what he has for us, and we connect and we continue connecting. Have a lovely day, a lovely evening, everyone, wherever you are. Thank you a lot. Bye bye.